Hi and welcome to this patient information video in which we will look at one of the most common causes of forefoot pain, a Morton's type neuroma. This video has been brought to you by Mr. Stuart Metcalfe, one of the UK leading consultant podiatric surgeons with over 30 years of clinical experience. Stuart is the clinical director of foot consultant clinics with centres in Birmingham, London and Southampton. The video is intended for patients and provides general advice on the causes of Morton's neuroma and helpful advice on what you can try to reduce your pain. We will then talk through some of the other effective treatments for this painful condition. Please remember that this video is intended to provide general advice only, and you should always seek professional advice before embarking on any treatment. Morton's neuroma can also be referred to as Morton's metatarsalgia, plantar neuritis, interdigital neuritis. You may come across some of these different terms if you have tried to Google your foot pain. It's really important that the condition is properly diagnosed to ensure you are provided with the right treatment options. Let's look at some of the other causes of forefoot pain which can be misdiagnosed as a neuroma. The nerve supply to your feet comes from your lower back, called the lumbosacral region. If the nerves here become pinched, it can cause symptoms such as sciatica. Occasionally, problems of nerve entrapment in the back can present as localized foot pain. Nerve entrapments can also arise from within the foot, producing symptoms that mimic a neuroma. One such condition is called tarsal tunnel syndrome. This occurs when the nerve behind the ankle becomes compressed. Another cause of forefoot pain is damage to the joints at the base of the toes. This can be the result of injury, arthritis, or inflammation around the joints, such as capsulitis. These are just some of the causes of forefoot pain, which can easily be confused with a neuroma. Mr. Metcalfe will carefully examine your feet to work out the cause of your foot pain. Let's take a look at what a neuroma actually is. This is a picture of a typical neuroma which has been surgically removed. The red arrow shows the thickness of the normal nerve providing sensation to the toes. Notice that the nerve is thickened toward the toes at the site of the neuroma shown by the blue circle. Morton's neuromas are not cancerous, and in fact they are not really true neuromas at all. We think that they are caused by repetitive microtrauma to the nerve, which results in fibrosis or scarring within the nerve. This can cause the damaged nerve to become thickened and to send abnormal pain signals. The risk of developing a neuroma seems to be linked to three key factors. These are activity, interface, biomechanics. People who subject their feet to higher than normal wear and tear may be more at risk of developing a Morton's neuroma. Runners, waitresses, chefs, and teachers, for example, who stand on their feet for a long time, may be at particular risk. Another risk factor is believed to be traction on the nerve. Electricians and plumbers, for example, who have to crouch for long periods, create a traction on the nerves in the ball of the feet. This is thought to alter the blood flow within the nerve, leading to the development of neuromas. What we mean by interface is the connection between the foot and ground. This might be the type of shoes we wear or the surface we walk on. These shoes may look great, but they offer virtually no protection to the foot. On top of that, the high-heeled design increases the pressure over the ball of the foot compared with these lower-heeled padded shoes. Don't forget, if you're a runner, make sure your shoes are still fit for purpose. Just like the tires on your car, the materials in your trainers becomes less effective at protecting your feet over time. Mr. Metcalfe will be able to advise you on the best footwear for your activity and your foot type. The third risk factor in the development of neuromas relates to you and the mechanics of your legs and feet. Again, your Mr. Metcalfe will be able to check your biomechanics to see what can be done to reduce your neuroma pain. About 70% of neuromas occur between the third and fourth toes. About 30% develop between the second and third toe. Most patients will give symptoms which include one or more of the following: burning, numbness or shooting pains into the toes, a need to remove shoes and massage the area, cramping or clicking, splaying of the toes as in this patient who has a neuroma between the second and third toes. This splaying is caused by the neuroma disrupting the small tendons and ligaments that support the toes. In most cases, your Mr. Metcalfe will be able to confirm your diagnosis based on your history and careful examination. Sometimes, though, It is necessary to arrange an ultrasound scan or MRI to confirm the diagnosis of the neuroma or to exclude another pathology. These investigations are always necessary should you need surgery to remove the neuroma. Okay, let's look at some sensible treatment options. Definitely think about changing footwear to reduce the mechanical irritation to the nerve. Consider reducing or adjusting your activities, for example, change from road running to running on grass or tracks. If possible, try reducing how much you stand in work. Talk to your employer about options for sitting more often. If you work where you have to stand for long periods on hard floors, ask about anti-fatigue mats, which can reduce not only foot pain, but also backache. We know it's not always possible to make major changes to the work environment, but even small adjustments can help. About half of patients diagnosed early will see a big improvement with these simple measures. If after, say, 6 weeks, things are no better, then Mr. Metcalf will discuss with you the next options. Custom orthotics can be very effective in reducing the pain from a neuroma. They work by reducing the pressure under the ball of the foot at the site of the neuroma. They carry virtually no risk of complications and can help prevent recurrence in the long term. The design of the custom orthotic will be based on a detailed biomechanical assessment. Several scientific studies have confirmed that orthotics can be very effective in reducing forefoot pain caused by Morton's neuromas. Next on the treatment ladder are cortisone injections. These are often used in patients who have severe pain and inflammation. The injection helps settle down the inflammation around the nerve. Injections on their own typically don't cure neuromas, but they can be very effective in reducing acute symptoms. To reduce the risk of recurrence, you may be advised to continue using custom foot orthotics. By damping down the initial pain and inflammation, other elements of treatment, such as a change in footwear, lifestyle changes, and custom foot orthotics, can have a better chance of success. If necessary, these injections can be repeated 2 or 3 times a year. Note, however, that over time, injections tend to become less effective. Other treatment options can include shockwave therapy, manipulations, and pain medications. In some cases, despite everything, these conservative measures fail to cure the neuroma pain. In these situations, you may be advised to consider surgery to either remove or decompress the neuroma. If Mr. Metcalf feels surgery is an option because conservative measures have failed to cure your neuroma pain, you will need to have a scan of your foot first. Surgery can be carried out under local or general anesthetic. You don't have to stay in hospital overnight. You will need to take it easy for 2 weeks until your stitches are removed. During this time, you will wear a special post-operative shoe. Surgery is successful in most patients, and Mr. Metcalf has performed thousands of these operations, as well as lecturing on nationally and internationally on this topic. We hope you have found this video helpful in explaining what a Morton's neuroma is, and some of the more established treatment options. Remember that there are lots of conditions which can mimic a neuroma, so please get expert advice. If you feel an appointment in person, by telephone or Zoom might be helpful, please contact our clinic and one of our staff will contact you directly. You can email us at secretary@footconsultant.com.